Hi, I'm Tessler. I am a plastic surgeon at LSU, and I have been privileged enough to work towards beginning a migraine surgery program in the Center of Excellence over here in New Orleans for patients suffering from this disease. Migraine is the 9th leading cause of disability in the world. The treatment of migraine surgery doesn't lump all of migraines together, and we call it migraine surgery because that's just is the best name that we have for it. It's just a simple name. Not all patients with all migraines are a candidate, and not all will respond to therapy. It might seem strange that you'd have plastic surgery that could be used to help treat this disease. But what we do find is that in certain patients, patients that have had some effect from Botox, patients that we can actually freeze nerves that exit the skull at different points, and they tend to do better. And if we go and we release those nerves, and the best way I can make a comparison is it's kind of like a carpal tunnel or any kind of peripheral nerve condition where you release that nerve and allow the compression to go away. These patients tend to do pretty well. Studies are consistent across multiple institutions. Anywhere from a third to half of the patients can stop their medications. I wouldn't go so far as to call them cured, but they're symptom-free long-term. And then anywhere from 2/3 to 85% in different studies will have a greater than 50% improvement in their symptoms. So these are surgeries that have very low morbidity or complications and generally produce long-lasting relief.
Okay, I heard about Dr. Tessler on TV and decided to come in for an evaluation. My symptoms I was experiencing was an ever-tightening band. It would start off in the morning around the top of my eyes and to around the back of my head, and by the afternoon I would usually require taking Advil or some other pain medication. Sometimes it was so bad that didn't work, and I would have to retire to my bedroom and just stay in the dark until the symptoms would subside. So it was interfering with my life. When I came to Dr. Tessler, he gave me a lot of hope and that I might be able to alleviate those symptoms with the surgery, and he described the surgery I would undergo.
What we look for is that patients that have a very, very identifiable zones of what we call trigger points, where they can point and they say, the migraine, it always starts exactly here. And what we found is that where patients point to tend to be exact places where nerves exit the skull. And so it's very consistent that. So we look for people that have intermittent migraines, that have consistent patterns and consistent anatomical areas that they will notice are places where it begins to hurt. Patients, if they've taken Botox and have had relief, is a very positive sign. For our evaluation, when they come in, we actually prefer them to have a migraine when they're coming in, and we can inject local anesthetic directly to the nerve. Doesn't affect the muscle, doesn't affect anything. And we can see within 10 minutes, normally, an effect.
I went through the surgery. I was a good candidate for the surgery, and I had the surgery performed. The recovery was a little long, but it's 6 months now, and I feel like I'm fully recovered from the surgery. And the best part about it is that the symptoms of the migraine are gone. 100%. I do hear from persons, friends that say, oh, I know someone that suffers. Usually it's a secretary in an office, because I believe women do have it more than men. I always suggest call Dr. Tessler, because he relieved my symptoms, and I thought there was going to be no relief from my headaches. And I have received 100% recovery.